Very good morning to one and all. Myself, I am Dr. Pawar. In this thorax lecture series, we have started lectures from the intercostal space. Typical intercostal space we have seen. After that, we have seen mediastinum and its content. And this is the third lecture. That is, you can see the topic here, lungs and bronchopulmonary segments. Here, we are in the cavity of the thorax. As we know that this the cavity of thorax consists of two important structures or organs. One is the lung and another is heart. Along with that, there are all the related structures, lymphatic as well as vascular structures within the thoracic cavity. There is important structure which covers from inside the viscera and also from the inner side of the thoracic cage, that is a pleura. So what we call as parietal pleura and visceral pleura. So in today's lecture, we will focus on these lungs and bronchopulmonary segments. This is a very important structure. This can come as a short note for the 7 marks in that you are supposed to write in detail about the bronchopulmonary segments. We will see at the end. Before that, these lungs, which is an important structure and parcel of the respiratory system and which is situated in the thoracic cage, that we will see. In this picture, we can see here the thoracic cage basically here, and you can see a part of the respiratory system which is starting from here, nostril. This is the external nose, this is the nostril, internal nose, nasal cavity. You can see here superior, middle, and inferior bronchi here. Then from here, the air which will come here with the common part of the pharynx, oropharynx. Above that we call as nasopharynx, and below that is the laryngopharynx. Now here it is a larynx, which is a voice producing box. So air passes through it. Then below that we get a trachea. You can see here the tracheal cartilaginous rings, around 15 to 20 there in this trachea. It divides at the level of T4, fourth thoracic vertebra, and these are the principal bronchi. Basically, this air pipe brings the air which should be clean, little bit warm and moist. And this air runs through this air pipe, trachea basically. And this trachea redivides in this the lung, and ultimately at the end we get alveoli. So basically we get two lungs here, right and left, which are situated in this thoracic cavity. This is a thoracic cage. You can see here in this section, these are the ribs. You can see intercostal spaces which are filled with the muscles. There are external intercostal muscle, internal intercostal muscles, transversus thoracic muscle here. So all this fill up this the space between the two nearby ribs, what we call as intercostal space. Important neurovascular structures that running through this the costal groove, which is just below that particular rib. They are running around the thoracic cage. And within that, this the lungs they are situated what we call as right side lung and this is left side lung. So two lungs. This is toward the lower side. This is a thoracic thoraco-abdominal diaphragm, what we call here. It is a musculo-tendinous structure. And over that, lungs are resting here. You can see here the angles, which are called as the costophrenic angle. So between di diaphragm and this, the lower part of this, the ribs here. So they are forming acute angles here. Basically, they contain lymph fluid or serous fluid normally. Whenever these angles they are very important clinically because when there is a injury in this thoracic cage, road accidents and all that, rupture of the rib, then bleeding occurs, all that will come and situated into this deep space. So these angles it should be usually acute, and if it is excessive fluid connection here on X-ray, you can see here this angle become blunt. So, for example, in case of pleural effusion, in that case, excessive collection of the fluid in this angle takes place. Being at the lower side due to the gravitational force, so fluid will come and settle in this place. If there is a bleeding, blood will come. If there is a infection, pus will come and settle down here. So in this way, this thoracic cage, you can see here the two important right and left lungs, and this is the mediastinal space. And here, that organ is not present, but the space is for the heart. You can see a cardiac notch which is on the left side here. So heart is situated in between the two lungs here. Then all these important branches and all that they will come here. The bigger branches, then smaller branches, then descending thoracic aorta will pierce the diaphragm if you go down. The rest of the branches from the heart, right, they will supply blood to the upper limb, blood to the head, face, neck. Right? Coming to the important today's topic, that is lungs. So you can see very nice picture of the lung here, right side and left side. You can see it is expanded. It has upper part, it has a lower part. Upper part is toward the neck, right? You will get here clavicle, right and left clavicles here. You can see here the base is toward the diaphragm. It is resting on the diaphragm. You can see here additional covering, which is called as pleura. So one part which is toward the tissue, toward the organ, toward the viscera, it is called as visceral pleura. While the other layer surrounds the inner aspect of this thoracic cage, this is called as parietal pleura. So there is a potential space between the parietal pleura and the visceral pleura, and in this there is a fluid, serous fluid, which acts as a lubricating agent. Apart from that, you can see the other features here. This is the right side lung. You can see these are the grooves, right? What we call as fissures here. So you get oblique fissure, right? You get the horizontal fissure, you get oblique fissure. Right? Here, the you can see here right? The horizontal of the transverse fissure, only one on the left side. So these are few points what we can see in this diagram. So basically, it is showing the respiratory system, the upper respiratory tract, and here is the lower respiratory tract, which aims at the level of alveoli, which are within the lungs. So main function of the lung is to exchange the air. Whatever the oxygen, like pure oxygen coming from air, it is taken inside, and whatever the carbon dioxide, right, which is at the end of respiration, what we call expiration, so it goes out, or it is pumped out, and it will expel out here. So this continuous process is going on here. Nowadays, you can see here, right, or these lungs are very, very important right now in this present the pandemic situation, what we call corona. Basically, this the coronaviruses they affects the interest to this respiratory system tract. Basically, that's why we should close this the nasal area properly. So also chances to enter through is the oral cavity also. That's why we should cover the mask, what we say in precaution. So basically, they should not enter inside. And when they're entering inside, when they come to the respiratory tract, they're attacking over the lung tissue. And basically, the lungs capacity is reducing, so that oxygen level is reducing. So basic function of this lung is getting hampered due to the attacks of these viruses. In that view, these lungs are very important organs in our body. As already I have described, lungs, the two lungs, they are soft and not hard. They're soft, they're spongy because air is entering, it's running through that lungs. So it is a sponge-like, and it is elastic. So it can expand, it can come to its normal position, it can again expand when you take air, it is expanding. So basically, its lungs, what we can say, it is soft in nature, it is spongy in texture, and it is elastic. In the child, they are pink because they are not exposed to the pollution outside. So early age, in the childhood life, these lungs are looking very, very pink. But with the age, they are becoming dark and mottled because of the inhalation of the dust particles. A lot of the dust particles they're present, right? The smoke, the carbon particles. So due to the pollution, the increasing environment, we are taking such air inside. So all these dust particles, the carbon particles, so it is purified and it is settling in the lungs, and pure air is taken like in alveoli for exchange purpose. Due to the deposition of this the pollutant particles, carbon particles and all that, that lungs becomes black. So as you expose to the more pollution, so your lungs become more black and black. So in early age, it is pink as it is not exposed to the pollution. So only the blood that the capillaries running through it. Okay. Due to that, you can see the color is pink, pinkish. The lungs lies on one on each side of the mediastinum. Mediastinum is the space between the two lungs. So lungs are residing on each side of the mediastinum. So we get right lung and left lung. The two lungs are separated from each other by the heart and blood vessels, big vessels, and other structures in the mediastinum. As already I have defined the mediastinum, it is a space between the two lungs. Within that, the important pumping organ, an important structure of cardiovascular system, that is heart, is situated. Along with its big blood vessels, they are present here, what we call as great vessels. For example, ascending aorta, arch of aorta, descending aorta, then three branches from the arch of aorta. You get brachiocephalic, you get left common artery and left subclavian artery. These are the great vessels around the heart. They are also part of it that present there in the mediastinal space. Each lung is the shape that it is conical, covered with visceral pleura and suspended free in its own pleural cavity. So as it is covered by the two types of pleura, visceral and parietal, so there is a pleural space or pleural cavity. Normally within that you get presence of the serous fluid there, and due to that it acts as a lubricating agent when the lungs are expanding and reducing its size. So that time it is acting as a lubricating agent. So each lung is conical in size, say covered with visceral and parietal pleura and suspended free in this pleural cavity. Attached to the mediastinum only by its root. So root is a structure, right? So its root, it is attached to the mediastinum, and through the root, all important structures are entering and leaving from the lungs. A blunt apex, as being this is conical in shape, the blunt apex, upper part, what we call as apex, so it is a blunt, it projects upwards into the neck for about 1 inch, around 2.5 centimeter above the clavicle. So this is apex or the upper part of the lung, which comes above clavicle by near about 2.5 centimeter. The concave base that rests on the diaphragm. So in the previous diagram you have seen, this is the base. This base is resting in the diaphragm here, and this is the apex, which is going just above the clavicle 2.5 centimeter. So it has a, this is a conical shape, it has apex and it has a base. So base is resting on the diaphragm, which is concave. A convex costal surface which corresponds to the concave chest wall. Now, we know that the thoracic cage, so the ribs are there, and there the you can say concave. So here for the costal surface of the lungs, we can say it is a convex. So a convex costal surface which corresponds to the concave chest wall is there. The concave mediastinal surface which is molded to the pericardium and other mediastinal structures. Pericardium is a layer like a pleura. It is covering around the heart, that is called as pericardium. Peri means around and cardium is concerned with the heart. So pericardium is an additional layer which is surrounding the heart. So a concave mediastinal surface which is molded to the pericardium and other mediastinal structures, including the great vessels. Another important structures one should know is a hilum after the root. Hilum is a depression in which the bronchi, vessels, and nerves that form the root. So these are the structures which are forming the root, bronchi, the vessels, and nerves. So that form the root enter and leave the lungs. So this hilum is a depression in the medial surface of the each lung, right and left. And through that hilum, the roots are there, and through the roots, these important structures, principal bronchi, so vessels, so pulmonary vessels, bronchial vessels, and nerves, they are entering and living through this root and through this hilum. The anterior border is thin and overlaps the heart. It is here on the left lung that the cardiac arch is found. The posterior border is thick and lies beside the vertebral column. So it has basically the three borders: anterior border, posterior border, and you can say the inferior border. Now, anterior border is thin and overlaps the heart. And the posterior border is blunt. It is thick. You cannot pinpoint or you cannot. It is not sharp basically, so it is blunt and it is thick, right beside the vertebral column and backside. The right lung, the inferior border that rests on the, it separates the inferior surface from the, you can say, the posterior surface. The right lung is slightly larger than the left. So on the right side, the bulk of the lung is heavier as compared to the left lung. So the right lung is slightly larger and heavy than the left. Divided by oblique and horizontal fissures. There are two types of the fissures. One is called as horizontal or transverse fissure, and another is oblique. Depending on its position, we call oblique and horizontal fissures. Into this, and due to these two fissures, the right lung is divided into the three lobes. So there are two fissures and three lobes. This is the characteristics of right lung. So due to these two fissures are deep grooves. So due to these fissures, lungs can expand very well with its full capacity. Due to that, these fissures are embryologically developed there. So three lobes, what are the names on right side? You get upper lobe, you get middle lobe, you get lower lobe. So on right side, which is larger and heavier lung, it is it has two fissures, oblique and horizontal, and three lobes, upper, middle, and lower. You can see here, this is the right lung, this is the mediastinal surface. You can see this is a root which is present in the hilum. So here is a depression on the medial surface of the each lung, right and left. So on both sides you are getting hilum, on both sides you are getting on the medial surface roots. So this is the right lung, and this is upper part of the right lung, what we call as apex. While this is the lower part, right? This is the resting on the diaphragm. This is called as diaphragmatic surface. Okay? Or also, in other word, we can say it is the base. So it has apex and it has base or diaphragmatic surface, which is a concave, resting on the diaphragm. Now here you can see this is the anterior margin or anterior border, and here is the posterior border, which is a blunt and which is along with the vertebral column. Anterior border, which is sharp, it is overlapping over the heart. Basically, this posterior border, which is the blunt, and this is inferior border. So, which separates this the posterior surface right from the inferior surface. Also on middle side, mediastinal surface separated from the inferior surface. So basically, there are three borders for each lung, right? And accordingly, you get the three surfaces also. One is posterior surface, which is a convex. This is a mediastinal surface. And this is an inferior surface and diaphragmatic surface. Right? And this is the root of the lung. Now it is covered by here, right? The visceral pleura, and also the coming the parietal pleura here. And this parietal pleura, it hangs down. Okay? And again it comes up. So you get a potential space between these two parietal pleura, and this is called as pulmonary ligament. So this is a dead space clinically. Now what is the importance of this pulmonary ligament? Because whenever these vessels, right, which are present in the root of the lung, so they increase in size, what we call dilated. That time, this potential space is going to adjust this dilated blood vessels. So this pulmonary ligament is very important. One thing is that it is on the lower side, and it is nothing but the double layer of the parietal pleura, which is hanging here just below the root or below the hilum, and this is called as pulmonary ligament. Apart from that, you can see the important structure here in the root of the lung. Right? This is the anterior surface, right? Anterior margin. So from anterior to posterior, you can see right? They are van structure. Instead of that, valve you can remember here. So V is for vein. So you get pulmonary veins here. In case of the pulmonary, we know that it's a reverse. The veins which are breathing, they are not actually bringing deoxygenated, but they are bringing oxygenated blood. That's why they're showing the red color here. So most anteriorly you are getting pulmonary veins, and you are getting pulmonary arteries. Arteries are bringing here the deoxygenated blood right from the left at right atrium to the lungs for the purification or mixing with the oxygen. So most anterior pulmonary vein, then you get pulmonary artery, and instead of now you can remember the bronchus. So from anterior to posterior, you get VAB, VAB, V for pulmonary veins, A for pulmonary artery, and this is a bronchus. The part of the bronchus is here. Apart from that, you are getting bronchopulmonary artery, lymph nodes are there. Either lymph nodes are there, and then important nerves, they are also running through it. So these are the content of the roots of the lungs. Right? So something is different on right side, and something relation wise you get different on the left side. Apart from that, in this picture, what we can see, we can observe the mediastinal surface of the right side lung. So various impressions you can see here, and they are very important. These impressions, they are due to the structures which is running through the mediastinum between the two lungs. So what are these impressions? Toward the apex on the medial surface, you can see this is the area for trachea. Air pipe is coming here, right? Then it is dividing into the principal bronchi and entering within the lungs. So this impression is due to the trachea. Behind that, it is due to the food pipe, that is esophagus, right? So this impression is for the trachea. This impression is due to the esophagus. Next to it, you can see this is a groove for the brachiocephalic vein. You can see here, this is azygous vein groove, with impression due to the azygous vein. These two veins joins together, it forms superior vena cava. So this is the groove for superior vena cava. So superior vena cava, you can see brachiocephalic vein here. You can see impression for the azygous vein. This is for the trachea, this is for the esophagus. Right? And this is brachiocephalic vein, already we have seen. This groove is for subclavian artery. So nearby tubular structures create impressions on this mediastinal surface of the lung. We are seeing toward the right side, means right lung. You can see here this impression is due to the heart. Right? So it is called as cardiac impression. Apart from that, you can see here the two fissures. This is as the right lung. There are two fissures. So one is called as horizontal or transverse, and another is called as oblique fissure. So oblique fissure starts from here, right, like this, and it is going here obliquely up to this posterior border. So this is an oblique fissure. Here it is a transverse or horizontal fissure. Now due to these two fissures, the right lung is divided into the three lobes. So this is a upper lobe or superior lobe. You can see here this is a middle lobe like this, and this is an inferior lobe. Red or reddish color, that is inferior lobe. So for the right lung, there are two fissures and three lobes. These are the structures in the roots, okay? And these are the various structures creating impressions on the mediastinal surface of the lung. This is a diaphragmatic surface, which is a concave in nature, and it is resting on the diaphragm. And these fissures, grooves are very deep. Due to that, these lobes can expand. Right? Its maximum capacity, maximum air means oxygen we can take inside, and that is given to the blood vessels so that uh, the or in alveoli, so it can exchange or it can give more oxygen to the blood, and then it can return to the heart. So in this way, this diagram explains. Right? Exam point of view, question may be sometime, right? Drawing level diagram of the mediastinal surface of the right lung, or same way where you get the left lung. So you are supposed to draw, make the practice to draw the diagram showing the various impressions, structures within the root of the lung, this pulmonary ligament, inferior surface, this oblique and horizontal fissures, and various lobes. So lobes and fissures of the left lung. The left lung is divided by the similar oblique fissure into the two lobes. Now what we have seen is for the right lung. Now this is for the left lung. The left lung is divided by the similar oblique fissure. So there is only one fissure on the left side, while on the right side we have seen two fissures. Due to this only one fissure which is oblique, this left side lung divides into the two lobes. And what are the names of lobes? One is upper, another is lower lobe. While for the right side we have seen upper or superior lobe, middle lobe, and inferior lobe. So here are two lobes only, upper and lower. There is no horizontal fissure in the left lung, but it is present in the right lung. So one should be able to differentiate what is the difference between right lung and left lung. So these differences we can give. Right side lung is heavier, left side as compared to the left lung. Right side is the two fissures, horizontal and the oblique, while on left side only one fissure. Right side is the three lobes, upper, middle, and lower, while the left lung, due to the only one fissure, there are two lobes, upper and lower. This is the mediastinal surface of left lung. Already we have seen of the right lung. So here it is for the left lung. You know that for the left lung, there is only one fissure, that is this oblique fissure. Due to that, there are only two lobes. This is the upper lobe and this is the middle lobe. Apart from that, you can see the roots structures within it present in the hilum. Right? So this is for the left lung. Here also you can see that most anteriorly you are getting veins, then you are getting artery here, and then you are getting bronchus. So VAB, right? And apart from that, you can see the hilar lymph nodes. So these are the pulmonary veins, these are pulmonary arteries, and these are the bronchus structures here. And this all is the root of the left lung. You can see it is the same way pulmonary ligament for the left lung. Only impressions you can see here are different as compared to the right lung. Now this is the apex of the left lung. This is the base of the left lung, which is resting on the diaphragm. This is the diaphragmatic surface. So same way here, there are three borders, three surfaces and all here. We will just revise what are the impressions on the mediastinal surface of the left lung. So we can start from here. This is area of trachea and esophagus. This is groove for the subclavian artery. So this structure same we have seen on the right lung also. So here it is mixing trachea and esophagus, but on the right side, you can see the separate groove for the trachea and esophagus. It is common way here for the left side lung. Then you can see here, this is groove for the left brachiocephalic vein. You can come here, this is the anterior border. And only for the lung anterior border, there is a special feature that is called as cardiac notch because it is making a notch-like structure here. And heart is exposed to this area. That's why it is called as this notch is called as cardiac notch. When this tongue like the tongue shape, the lower part here, this is called as lingula and which is present on the left lung only. So these are the features to identify the left lung. One can see cardiac notch and one can see lingula. The tongue shape the process here, right? And this is the anterior border which is sharp here. This is the posterior border which is a blunt along with the vertical column. This is the inferior margin or inferior border to separate the mediastinal surface, costal surface from the inferior surface, diaphragmatic surface, right? This important one, right, for the left lung, you can see this is a groove for arch of aorta, right? And this is for the descending aorta. So this is a groove for the descending aorta. Once you come here, you can change. This is the arch of aorta, right? So this is very important and prominent groove here you can see on the left lung. This is a groove for the esophagus. So esophagus you can see right. So it continues from here also and it continues here. So you can see the main impression here below the root and the left root. This is the groove for the esophagus, which is not seen in case of the right lung. And this is the cardiac area, cardiac impression. Okay? So the heart chambers, right? They are making impression over this left side lung. So in this way, this is the mediastinal surface of the left lung. This also can ask as an exam point of view, okay? Draw a level, the diagram of mediastinal surface of the left lung. So you have to remember all these important impressions over the structures within the root of the left lung and the fissures that only one you get the oblique fissure here and the two lobes. Then coming to the second part of the today's lecture is bronchopulmonary segments. The bronchopulmonary segments are the anatomic, functional, and surgical units of the lungs. So one can define it is a anatomical, functional, and surgical units of the lungs. Each lobar and secondary bronchus gives off branches called as segmental or tertiary bronchi. So basically, when trachea comes, trachea divides at the T4 level into the right and left principal bronchi. So it's a primary, right, principal. And below that, for the each lobe, right, what we call a secondary bronchus. So for the right side, there are three lobes. So it divides into the principal bronchi, divides into the three secondary, or the, you can say the lobar bronchus. While on the left side, only the two. And then later on to the each segment. So at tertiary level, right? So this bronchi divides. Each segmental bronchus passes to the structural and functionally independent unit of the lungs called lung lobes called as a bronchopulmonary segment surrounded by connective tissue. So one can again add one point. So the area of the lungs which are aerated means air is given by tertiary level of the bronchi. So the space or the area aerated by the tertiary bronchi is also called as bronchopulmonary segment, which is the anatomical, functional, and surgical unit. If you see the shape, it is a pyramidal shape. So one can mix all these points and one can define the bronchopulmonary segment. Each segmental bronchus passes to the structure and functional independent unit of the lungs lobes called as bronchial segment surrounded by connective tissue. The segmental bronchus is accompanied by branches of pulmonary artery. The pulmonary artery brings deoxygenated blood from the right ventricle of the heart for the purification. Each segment has its own lymphatic vessels and autonomic nerve supply. On entering the bronchial segment, each segmental bronchus divides repeatedly, again redivides into the various smaller branches. As the bronchi becomes smaller and smaller, the U-shaped bars of the cartilages due to the cartilage patterns is possible. So this U-shaped cartilages we found in the trachea, which are typical we are found in trachea, are gradually replaced by irregular plates of the cartilages. So as you go downward, this the U-shaped or C-shaped cartilages rings, they're breaking down and they're becoming irregular small pieces. The smallest bronchi divide and give rise to the bronchioles, okay, which are less than 1 millimeter in diameter. So as you go down, when you are not getting the complete the C-shape the ring of the cartilage, then we call that they are bronchioles. So bronchus and bronchioles. As you go down, these cartilages are absent and all the muscular part is increasing. So as you go alveoli, the lower end, the bronchus cartilages are absent and only the muscular part is there. Smooth muscles are there. The contraction increasing more as you go down. So later on we call as bronchioles. So basic difference in bronchus and bronchioles. In bronchioles, as you go down, cartilages are absent. In bronchus, they are present as a hard structure within the bronchus. You can see here in the upper part, you can see where the cartilage plates as in upper part, and as you come down, so that cartilage are absent. Now it is becoming only the smooth muscle part, more contribution. And as you come down, you are getting the alveoli, right? So you can see here, right, the various branching, rebranching pattern, right, of this the tracheal tube. Bronchopular segment continuation. The bronchioles possess no cartilages in their walls and are lined with the columnar ciliated epithelium. This is a respiratory epithelium. And already I have described bronchioles possess no cartilages, so cartilages are absent in bronchioles. The submucosa possesses a complete layer of the uh, circularly arranged smooth muscle fibers. So as you come down, the smooth muscle contribution is increasing and cartilage part is decreasing. The bronchioles then divide and give rise to the terminal bronchioles, which show delicate outpouching from their walls. Gaseous exchange between blood and air takes place in the walls of these outpouchings, which explains the name respiratory bronchioles. So this is a magnified picture of the lower side. We are getting acinus, right, or alveoli, right? They are open here, right? And the gas is exchanging here, and around that we get the blood vessel plexus here, okay? The pulmonary venous plexus here, and these pulmonary veins, as the gases exchange takes place in the pulmonary veins, bring the oxygen to blood toward the left side of the heart. So in this way, this is magnified part of the, you can see the terminal bronchioles, right, respiratory bronchioles, and basically here alveoli we can see, right. So they are closed alveoli, outpost-like structure, and they are open here to see the internal structure. The diameter of respiratory bronchiole is about 1.5 millimeter. The respiratory bronchioles end by branching into the alveolar ducts, which lead into the tubular passages with numerous thin wall outpouching called as alveolar sacs. The alveolar sacs consist of several alveoli, more number of alveoli opening into the single chamber. Each alveolus is surrounded by a rich network of the blood capillaries, where gases exchange is taking place. Gases exchange takes place between the air and the alveolar lumen through the alveolar wall into the blood within the surrounding capillaries. You can see here there are the various alveoli. Around the alveoli, there are the pulmonary veins and pulmonary arteries. Pulmonary arteries that bring in deoxygenated blood. The gases exchange takes place, and the blood becomes red or reach an oxygen level, and this is brought by the pulmonary veins to the heart sides. They are bringing pulmonary artery, they are bringing deoxygenated blood towards this lungs, towards this alveoli, where the gases exchange. So in this way, in the bronchopulmonary segment, all this vascular structure around the alveoli is located there. So the area aerated by tertiary bronchioles in the pyramidal shape, surgical, anatomical, and structural unit of the lung, which is described as a bronchopulmonary segment. What are the characteristics of the bronchopulmonary segments? It, it is a subdivision of lung lobe. It is a pyramid in shape with its apex towards the lung roof. So the shape of this bronchopulmonary segment is pyramid, where its apex is towards the lung roof. It is surrounded by connective tissue. It has a segmental bronchus, segmental artery, lymph vessels, and autonomic nerves. So single bronchopulmonary segment has all the structures. The segmental vein lies in the connective tissue between adjacent bronchial segments. Because it is a structural unit, a disease segment can be removed surgically. For the right lung, we know that there are three lobes: superior lobe, middle lobe, and inferior lobe. For the superior lobe, right side, we are getting apical, posterior, and anterior. So three bronchopulmonary segments for the superior lobe. Middle lobe, you are getting lateral and medial bronchopulmonary segment. Like for inferior lobe, we are getting superior one, which is also called as apical segment. And you get medial, basal, anterior basal, lateral basal, and posterior. So middle side and lateral side, anterior side, and posterior. 4-1 on the lower side and 1 at the apical. So 5 segment bronchial segments for the inferior lobe, 2 for the middle, 7, and this superior lobe 3. So 5 plus 2 plus 3, total 10. So for the right lung, there are 10 bronchopulmonary segments. Also for the left lung, there are 10 bronchopulmonary segments. These different colored areas, they are bronchopulmonary segment. This is the right lung. So you get three lobes. This is the upper lobe, this is middle lobe, and this is the inferior lobe. So for inferior lobe, there are 5 segments: 1, 2, 3, 4, and 5. 5-1 will be apical, right, which is just in the center. And for the middle one, you get medial and lateral, so 2 segments. And here for the upper lobe, we are getting apical, we are getting medial and lateral. So in this way, 10 segments, bronchial segments for the right lung. Same way for the left lung, we are getting 10 bronchopulmonary segments. And the difference is that here it has upper lobe and lower lobe. Only 2 lobes are present for the left lung. Accordingly, we are getting the bronchopulmonary segments for the left lung. So as for the left lung, we know that upper lobe or superior lobe, there are apical, posterior, anterior, superior lingular, and inferior lingular. So 5 bronchopulmonary segments for the upper lobe or superior lobe. Same way, 5 bronchial segments for the inferior lobe. Names are the topmost we get apical, Then you get medial basal, anterior basal, lateral basal, and posterior basal. Same like the right lung. Right? So you are getting here instead of the 3 lobes, 2 lobes, and here for the upper lobe you are getting 5 segments. For the lower lobe you are getting 5 segments. Means total 10 segments are there. Bronchial segments for the left lung also. Blood supply from the bronchial arteries, which are the branches of descending aorta. The bronchial veins communicate with the pulmonary veins and drain into the azygous and hemiazygous vein. That impressions we have seen on mediastinal surface of the both lungs. The alveoli receives deoxygenated blood from the terminal branches of pulmonary arteries. They are drinking deoxygenated blood from the heart. Oxygenated blood leaving the alveolar capillaries drain into the tributaries of the pulmonary veins. So pulmonary veins collect oxygenated blood and that is brought toward the left side of the heart. The two pulmonary veins leave each lung root to empty into the left atrium of the heart. First it is coming from the left atrium. From left atrium it goes to the left ventricle and from left ventricle ascending aorta, arch aorta and descending aorta. Come to the last part, applied aspect of this bronchopulmonary segment. So one can remember the importance of this broncho segment as it is usually infection to the segment remains restricted. Due to this bronchopulmonary segment, infections are remaining within that segment only. So it is restricted to that segment only. Second, segmental resection is possible. If suppose one segment is infected, we can point out the location and we can do the surgical dissection by operation. We can remove that much segment only. Rest of the segments we can preserve. So segmental resection, surgical resection is possible. Drainage of infection if there is a lung abscess is possible by giving specific posture to the lungs, means to the body, and ultimately to the lungs. And due to the gravitational force, we can drain out that pus which is in the lung abscess and we can bring it out to the bronchial trees. So it is called as postural drainage. Then bronchoscopy. It is an endoscope which can enter or we can enter with this endoscope, right? So bronchoscope we can say, and we can observe the internal cavity of all this, the branching pattern of trachea or the bronchus. So we can observe with the help of this endoscope, right, bronchoscope, the interior structure of the bronchial tree, and overall this procedure is called as bronchoscopy. So bronchoscopy is additional applied aspect of this, or we can enter through this the various segments of the broncho segments of the lungs, right, with this bronchoscope, and we can observe the internal pathology is happening, right, in various diseases. So we can enter this bronchoscope inside and we can observe the internal cavity of this, the bronchial tree. We can give the bronchial lavage also, right? We can give the drainage, right? And we can clean that bronchial tree. If suppose foreign body is entering inside and if it is blocking due to that, right? Person is getting irritated, that epithelium of continuous thick cup is there. In that case, bronchial lavage is given. So with the help of this bronchoscope, we can give a normal saline wash, right? Normal saline wash to that bronchial tree. So we can observe for the various pathologies which is present within the bronchial tree with the help of this bronchoscope. This is called bronchoscopy. Right? With this, we finish this today's topic, in which what we have seen. Basically, we are focused on the lungs, and after that, toward the end, bronchopulmonary segments. So one can again go through this the topic, right? We can read this topic through the books. You can see the various diagrams, and you can understand the various aspects of these lungs, right? And the bronchial segments. I hope you understood all this today's topic. So here we are stopping for this today's lecture. Thank you.